بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وآله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about thickening distortion of the paraspinal lines and its importance in diagnosis of the posterior mediastinal masses with some examples. The paraspinal lines are interfaces between the lungs and the paravertebral fat and soft tissue. The left one is more commonly seen because the aorta promotes and more tangential interface to the X-ray beam. They are vertical lines parallel to the spine. Left, it is extended from the aortic arch down, generally medial to the para-aortic line. On the right side, it is in the lower thoracic spine, from 8 to 12 thoracic vertebra. The right paraspinal line appears straight and typically extended from the 8 to the 12 thoracic vertebra. The right paraspinal line may be displaced laterally by osteophytes or prominent mediastinal fat. However, abnormal contour or displacement may suggest posterior mediastinal abnormality like mediastinal hematoma or mass or extramedullary hematopoiesis. Left paraspinal line. The left line is formed by tangential contact of the left lung and the blower with posterior mediastinal fat, left paraspinal muscles and adjacent soft tissue. The left paraspinal line extends vertically from the aortic arch to the diaphragm, and it is typically lies medial to the lateral wall of the descending aorta. As in the right side, it is displaced by osteophyte or fat or tortuosity of the descending thoracic aorta, also displaced by abnormal mass lesion like mediastinal hematoma or extramedullary hematopoiesis or esophageal or spinal masses or varices. Here, this is the BA chest, and we see the right paraspinal mass extended, usually extended from 8 to 12 vertebra, thoracic vertebra, and here this is the left one. It is medial to the para-aortic line, and it is extended from the aortic knuckle to the diaphragm. Here another patient with paraspinal line on the right side and paraspinal line on the left side, and on the blue one it is the para-aortic line. And here the coronal CT scan with paraspinal line on the left side and paraspinal line on the right side. There are vertical lines parallel to the spine. As we see here in the axial cuts of the CT scan, this is the aorta and the para-aortic line here, and these are the paraspinal lines in the arrowhead in green color. Here, this is the sketch on the right paraspinal line, and seen here on the right side on just be a view in a patient. Here, this is the CT scan of the paraspinal line on the right side and paraspinal line on the left side, and here this is the para-aortic line. Here you see patient with a mass lesion on the both sides of paraspinal areas, and it is distortion and thickening and elevation of the paraspinal lines more to the right side than on the left side, by soft tissue mass on the paravertebral region, and also elevation, and it is also lateral deviation of the para-aortic line, as seen here in this CT scan axial cuts. And this is the caused by consolidation on the para-aortic line, and also on the paraspinal line, it is due to soft tissue component mass in patient with Hodgkin disease with involving of the vertebra here. Also another nodule noted on the right base, and a right hilar mass also seen on the right chest X-ray. Here, this is a patient with deviation and distortion of the abnormal right paraspinal mass, right paraspinal line in a patient 27 years of age with history of trauma. And this abnormal bulge on the right side here seen on the CT scan due to hematoma, posterior mesiastinal hematoma. We see the left paraspinal left paraspinal line is within normal. Here we see also there is bilateral pleural effusion with increased density due to hemothorax more to the right side. Here, this is chest X-ray. We see a bulging of the left paraspinal line, as we see here in the uh, coronal T2 weighted, coronal T1 weighted image, coronal T2 weighted images on the on the MRI, and that mass it is a neurogenic tumor. Here we see bulging of the left paraspinal mass. Also minimal bulging of the right one due to patient with lymphoma. Here, this is the patient with another patient with bulging of the both paraspinal lines on both sides, associated with diffusion on this patient, and the bulging here it is low attenuated area, probably cystic in nature, and this is an abscess. Also, we see here destruction of the of the adjacent vertebra. Here also the differential diagnosis include abscess formation in this patient. Thank you very much for listening. Hoping to see you again in another talk.